Welcome to yet another super exciting session as part of the WebCares initiative, which is the dedicated initiative for women entrepreneurs by the Women Entrepreneurship Platform. Niti Aayog's WEP believes that health and well-being forms the very core of success and quality of life for every woman. Entrepreneurs, super busy and involved in their work, need a reminder to take care of their health, hence the web series. Apollo Hospitals is very proud to partner with WEP and present various topics of particular interest and utility to our women entrepreneurs. I am Dr. Srinidhi Chidambaram, a consultant in public health, clinical outcomes, and health communications at Apollo Hospitals, and I'm delighted to welcome each one of you and introduce you to today's session, which is Power Through the Change, discussing how we as women can thrive at all phases of our hormonal changes, periods, perimenopause, and menopause. Hormonal changes are a constant companion throughout a woman's life, from the early days of attaining puberty, starting the period, to the challenges and joys of pregnancy, and eventually navigating the transitions of perimenopause and menopause. These shifts can profoundly affect a woman's physical, mental, and emotional well-being, whether it's the physical changes, the mental fog, the mood swings, the fatigue, or the stress. So understanding these changes and transitions is crucial, not just for your health, but also for your success as an entrepreneur. Today's session is a conversation that we've needed for far too long. As women entrepreneurs, you're often juggling a million things, deadlines, decisions, dreams, and in the middle of all that, our own health sometimes takes a backseat. But hormones don't wait for your pitch to end or a client call to finish. So today we're talking openly and powerfully about perimenopause, menopause, and periods. This is not just a woman's health issue, it's a business issue, it's a productivity issue, and above all, it's a quality of life issue. In this session, which is led by one of our superstar gynecologists from Apollo Hospitals, Dr. Rooma Sinha, we'll explore all science-backed insights and actionable strategies for you, and we will help you thrive and keep your business and leadership sharp. Welcome, Dr. Rooma. Thanks so much for joining us.
Thank you, Srinidhi. Thank you so much for those kind words. It's really, truly an honor and pleasure to be with all of you today. And I know Srinidhi and everybody else also knows that apart from all the things that you said, I love talking to women on such forums because I feel I could give so much back to the society as a group, and people can get aware of what they need to do and about their health, which I believe women most often put it on the back. So let's start the discussion and conversation today.
So I think the first question is on menstruation. So this is from one of our viewers asking, how can one differentiate between a normal menstrual discomfort and symptoms that require medical attention? This also ties in with what I wanted to ask you also, that, this menstrual period itself is experienced so differently by every woman. For some, it's a breeze, and for the others, it's like, they can't even get out of bed, or there's so much of variation in terms of irregular periods or delays or happening too frequently. So what is really normal, and when do we really, when do we have to seek medical attention?
Okay, so I'll take this whole question in 2 or 3 parts. The first part is, how do you know that your menstruation is normal? Well, all of us are different, so everybody will not have the same menstrual cycle. But remember to watch for 2 or 3 things. One is, how long is the distance or the days between 2 menstrual cycles? And the way to calculate is not on the day when it ends, but the day it starts. So the first day of this cycle to the first day of the next cycle is a cycle. It can be anywhere, say, 26 to 35 days. We consider that to be normal, not to intervene. The bleeding, and this is what most women experiencing that, be cool, no problem. If you are experiencing very less or more than that, is something to be a concern. Then in these 4 or 5 days, how much is the bleeding? How do you measure? I mean, you are not going to put something. People using menstrual cups today can have some idea because we know how much is the menstrual cup capacity, but the pad is very difficult. So look at two things. One, are you passing clots? Or are you using more protection than you were using earlier, which could be sign that you are bleeding more. And the last thing to look out is it associated? Breathe through and some have difficulty. When we look about your experience in periods, one is a psychosociological aspect to it, and one is a pathology or disease. Now, in the psychosociological aspect to it, we have to understand what kind of background how we have been, like talked about menstruation, whether it's to be something to be vocally talked about or kept in a secret, then you react differently. So that's the social aspect to it. But medical aspect to it, some patients don't, or some women don't have any problem. They have the period, they don't even realize it went and it came and gone. But some of them, as you said, are unable to get out of bed, are bleeding so heavily, having so much pain. Many of this, we normally say, if you're bleeding heavily, or the pain is intractable, or you have to take some injection or go to the emergency room, then something's wrong with you. Don't ignore it by family members saying, oh, it's pain, you have to bear with it till you have children. Don't believe in that. Get yourself evaluated, because problems like endometriosis, fibroids are now coming up much in younger women as well. So we cannot think that everything will go away after we get married or when we have children. So if you have intractable pain, if you think more than what I described as bleeding, make sure you have a gynecological evaluation done. And that would be ideal.
There's also this practice sometimes, which we might sometimes be seeing in people who have hectic business schedules or we have religious functions. So there's always this practice of, I don't know if it's so prevalent now, but then postponing the period by taking some Primolute. And I don't know how common it is now, but what would you advise women who are doing
Well,
that?
it's not uncommon even now, because as I said, with menstrual cycle, a lot of society baggage is there. I truly believe that something started initially, like for example, when you had periods, women were not allowed in kitchen, right? That was a common thing, but doesn't happen anymore. But why did that society started it? I believe it was more to give rest to women. Not that there was a taboo, but it became a taboo. That is, the taboo is again that if you're menstruating, you can't do prayer or you can't go to temple. So this request is not uncommon at all. And we do also give medications, help them with that because it psychologically impacts them so much. But my only suggestion to average women is that don't use it very often, because then you are messing up with the natural hormone that is being released from your body. So if once in a while is fine, but don't make it a habit that every second month I have to go to a temple, so I'll take something. And unfortunate for in our country, these things are also available over the counter. So you just have to go to pharmacy and the guy will tell you what to do. But then it will cause a lot of hormonal imbalance in the long run. So not suggested to take for very frequent times.
And we often hear about lifestyle measures that one can take to have a normal period. Does that really happen? And if it does, then what is the magic solution?
Okay, 100%. Because if you remember, if you know, our menstrual cycle is a culmination of certain hormones that are released. And that hormone, the first trigger is in the brain in the hypothalamus. Then it goes to pituitary. And then the signal comes to the ovaries to produce the hormone. And then those hormones act on your uterus and you get the period. So you're actually seeing only the end result. But there is a big hypothalamic pituitary axis that is going. We know that if the brain is stressed, this axis gets disturbed and your periods will get disturbed. So maintaining good stress or managing your stress is most important. The second is all this also gets disturbed with your abnormal BMI or weight gain. So if you are not taking care of your weight is more, then there is more problem. And so today, weight gain, lack of physical activity leading to menstrual disorder is a very, very common reason for which I find many girls and women walking into my office. And most often, when we look into their investigations, blood or scan or whatever, we find actually there is nothing I can find. All they need is an advice for lifestyle modification. I'm very glad that you have brought this up, because this has to be the focus of our health. On an average, it is said that if you can have 150 minutes of exercise every week in some kind of aerobic form or strength training and things like that, will help you. Obviously, it's a good lifestyle choice, but to also regulate. And if women who are having abnormal bleeding, abnormal cycles, do follow this advice, they will come back and tell me only, ma'am, in 3 months' time, I got my periods, I'm better now. But then when they get better, then again, we lose the track. So we have to be on it.
And I think for the busy women out there, I think, let me share that, what I've been finding very useful of late is that there are many, many very, very reputed trainers, yoga teachers who are now offering like 3 or 4 sessions online every
Yes.
day in different time zones.
Yes.
So, you really, and they encourage you to exercise with very little equipment. You don't really have to make a kind of a hoo-ha and go to the gym. So you can do it with pair of weights at home, a mat and some bands, or wherever you're going, wherever you're traveling. And I can personally say that I have found that extremely useful to finish off before the hard day's work begins. So there's plenty of options now, and you should explore them.
That's a good idea.
I think, yeah. And I think when before we move on to the menopause part, I just wanted to ask you, Dr. Rooma, about one more thing, which is about menstrual hygiene. So especially women who are at work the whole day, or who are traveling or running around, and they also have a heavy period. So, what do you have any tips at all on menstrual hygiene, and how often should pads be changed?
Menstrual hygiene is again a very personal choice. There are many ways of protection to be used. The common is being used as pads by women. But the pads, the problem is if it is not well placed, if it is not the right, X or XL, if it is not the right one, it may not contain your bleeding very well, and you may end up staining yourself, which can be a very embarrassment, especially at work or wherever it is. You have to look into other things. Menstrual cup that is becoming popular now is actually quite good because it contains the blood very well in your vagina. There is hardly any leak. But the problem with this, it's very messy if you have to use a public toilet, because then you have to remove that cup and wash it and this and that. It can be a little messy. So you'll have to figure out what is the kind of amenities you have. If you're traveling, then changing pads every 7 to 8 hours, or maybe even by 10 hours is a good idea. Make sure you have extra pads, extra liners, extra undergarments, maybe some, wipes, things like that, with almost in your bag whenever you are traveling. You could keep it also if you are not expecting a period, because sometimes we all know there can be an unexpected bleeding, and then can be very embarrassing. Keeping cool cotton clothes is a good idea around the time of menses, because you're also sweating. There is blood there. Blood is a good culture medium. If you keep that hygiene well, it'll be a good idea. Wash yourself whenever you are changing your pads or whatever, but remember to dry yourself before you put the next one, because a lot of moisture in the perineal area is also responsible for long-term infections, because everything remains moist and then it's just there. So these are some things which you need to take. If you're a very busy woman, you have to travel, or maybe in the office. If you can, maybe around the time of menses, do not, keep the pitch, or keep the very, very stressful thing around it, where you need to be 12 hours straight sitting on a boardroom. If you can. If you can't, then make sure your bathroom breaks are adequate, so they get the time to change and come back or whatever before you actually get under very much stress. So these are small things you can just work out depending upon how you're going with your cycles.
Absolutely. I think now we come to the bulk of the questions that have come from our viewers, which is largely about the next phase, where just when one thinks that, finally that pad can be thrown away and, it's the end of the periods, then come a whole lot of other things, the weight gain, the brain fog, the mood swings, all those things, the night sweats, the fatigue. So those signal the perimenopause and the menopause. So could you, the first question is about key hormonal changes that happen during menopause, and how do they impact a woman's physical health and emotional health also?
So all of you have to remember that basically all through your reproductive career that I said, from menarche to menopause, there have been a play of two hormones in your body, primarily. One is estrogen, the other is progesterone. Remember these two hormones. Now, estrogen and progesterone together builds up the lining of your uterus and you have the period. So they are a constant supply every month. They are also a constant supply because your ovaries have eggs and they are maturing, and that's how they're producing this. But as you reach menopause, the eggs have also gone. There is no way to produce much of estrogen. And because estrogen is not being produced, the progesterone also does not get produced, because that's how it works. The estrogen is a very useful hormone for women, actually, I must say. Why? Because it's not just giving you the period or not just letting you get pregnant, but it works right from your hair to your skin, to your heart, to your bones, to your mood, to everything. So that's a very good hormone for us. God has given us hormone till about 45, 50, depending upon where you land. But remember, you do not get totally zero on that hormone. So again, I would suggest all of you to look out for those symptoms. Take care of yourself, but don't get psyched that, oh, I reached menopause, so I have no hormones, or all this problem will occur. Not necessarily. As you say, just like menstrual, many women breeze through because you also have mentally prepared yourself. The second is that we also know that there are other hormones which your ovary and other glands produce, which is called androgen, which is a male hormone actually, which gets converted from the fat cells into a weaker form of estrogen. So your body continues to have estrogen, but a weaker form. So its body keeps getting something, but not zero. Having said these two, definitely the low estrogen is the main reason for all the symptoms that you spoke. We have solutions for that as gynecologists and as doctors. So if you're having, let's start with a symptom. The commonest two symptoms that menopausal women suffer is, one is hot flash, and there is what we call as a genitomenopausal syndrome. So menopausal genital syndrome, which could be dryness, itchiness, painful sex, all those things because of the dry vagina. For hot flash, we do suggest hormone supplementation. Hormone supplementation works best if it is started within first 10 years of your menopause. For the genital problem, local estrogen cream is sufficient and it doesn't cause much problem. However, if you choose and your doctor suggests that you should take hormone replacement therapy, then there's a whole thing that we need to discuss. But the solution is there. If you cannot take these two, we have non-hormonal medications also. If you cannot take either of them or don't want to, we have non-medical treatment, like even something like chamomile tea or soybean extract. All of them have some kind of phytoestrogens that can help you. So solutions are many, but I think we need to also reach this phase and think that this is going to happen. We cannot deny it. Just like, yes, right. So I think we start with a positive attitude with some supplements or something that is needed. Keep a good lifestyle. One important medication for everybody I would suggest is when you reach menopause, the first 2 years, you must supplement yourself with calcium because there is an accelerated loss of calcium from your bones. So these are some things which as doctors, we can help you. But as I said, reach that point with a positive attitude. That's very important.
So when we say positive attitude, that again is about strategies and practices that people can do starting from their 40s, perhaps when these changes might start happening. So again, what on a daily basis could women do to?
So the main thing is, there are two things that get affected. One is the brain and the other is the body. For the brain, I would suggest, am I audible?
Yes, Dr.
Okay.
Kumar.
So for the brain, let me put it this way, the more active we keep the brain, the better. So I believe the entrepreneurs here are very active. They are very busy with their profession, so the brain is always active. That's good. As far as the body is concerned, when we are working, we are actually abusing the body. We don't really realize what we are doing. And especially I can tell you as a surgeon, when I'm operating, I don't know where my hand, foot was. In the evening only, I realize what happened to me. But anyway, so stretching, keeping your joints mobile is a very good idea. Strengthening exercises will help calcium go back on your bones. So weight bearing calcium exercise. So you should, like exercise also, you should jumble it up. Don't do the same thing every day. If you're doing yoga, do 3 times a day. Go for a swimming maybe the other day. Do some weight exercises the other day. So I think you should at least, as I said, if 150 minutes is fine. So 5 days in a week, 30 minutes if you're doing, make sure different parts of your body is getting exercise. For those women who are reaching 45, 50, and are not working. The problem for them is they also at that point start facing the emptiness syndrome, right? They were so busy with the family, and now husband is very busy. You are not that busy in the office. So you start getting all kinds of symptoms. So keep yourself busy, learn a hobby, do something to keep your mind active. That will prevent what we call as memory loss. Even chat with somebody. Studies have shown just chatting with stranger can give you so much benefit these days. So I think that is where we have to keep looking and develop those little habits as we are approaching this.
So are these mental health changes, are they really somewhat, very common during menopause, as in anxiety and depression, or kind of moving towards a low mood or mood swings? So we've heard of all that. So when do you think is a time when they have to take medical help? As what I've understood so far, I think even just as you said, like when people have issues with their periods, they must not just think that it's part of life. Menopause also, there are many solutions. So I think the first step is to seek help, to seek medical help, to do the regular checks, to do the annual
Yes.
checks.
Yes.
And of course, we have all those cancer risks coming up. So mammogram and pap smear and all that. But what about the mental health? So at what point do we have to see that, like, or is it that, a visit to the gynecologist regularly would also help them identify where extra help is needed? Or is it something that is a myth that menopausal women may sometimes develop a larger mental health issue?
See, mental health issues is again a reality. Now we are seeing across ages. Women are more affected than men, no doubt. And hormones are responsible for our mental well-being. That's why I said, when I talked about estrogen, I said it's also keeping your mood and psychology better. So this is important to understand that. As the hormones dwindle, not everybody will get into anxiety and depression, but you also have a predilection. Some women have a predilection of having this problem, and they will suffer more. Talking to somebody is a good idea. Many times you may not go to a psychologist immediately. You may even come to a gynecologist, and talking to you for 5 minutes, I may realize that you may be having that problem. Having a problem is not a problem. If somebody says you're having anxiety and some depression, it's not a problem. It's good, because what you were feeling, we have a solution. We can give you medications, we can give you counseling, and then within few months or years, you get back to where you were. So if you think that this is the time when I'm unnecessarily angry on people where I normally didn't used to be, I'm crying at the drop of the hat where did not disturb me earlier, I'm unable to sleep, I am having palpitations or anxiety, or to go out and talk to somebody, I'm feeling as if, do I need to do this? So if these are the things which didn't happen to you earlier, it could very well be because of the change in the hormonal levels. So either there's no reason to grin and bear, talk to somebody, even maybe just taking a counseling session might help. You need not require medication all the time. So I think it's important to be aware of that. Yes.
I have here a question from Anupama Agarwal and Radhika here on the chat box, asking again about non-medical ways to cope with perimenopausal symptoms like fatigue, mood swings, and brain fog. I think you've already covered it, but in the
Okay,
perimenopausal phase too.
Okay, so for fatigue, there are a few things which I will tell you. Check for your vitamin D level, check for calcium and magnesium level, and also check for your iron level, not the hemoglobin. These in the background have shown to cause fatigue in women. So if you're having fatigue, don't just blame it on the hormones. There could be some deficiency as well. So let's do a check, as Srinidhi was talking about. It's a good idea around that time if you have never had. So good to do other things like pap smear, mammogram, because as you're reaching menopause, it's not just about the hormones. It's also about your higher chance of developing malignancies, your higher chance of developing cardiovascular problems. So it's a good idea to screen yourself for all this and see where you stand and take preventive measures. So if supposing you have or bone scan for that matter, osteoporosis is very common in our country. So if we don't do a bone scan, we wouldn't know till we have a fracture. So doing a bone scan, we'll know, okay, I'm in osteopenic phase. I should take this medication, do this exercise, take calcium. You'll prevent a fracture and you'll know how to deal with it. So doing preventive check, looking after these things is very important. However, low hormones can give you low mood. A lot of women also suffer from low libido. That means low sexual desire, which is again, they are unexplainable. They cannot understand. They are in the so-called prime of their life, but then they have that problem. So that adds to the problem of depression and anxiety and, why is this happening to me? And of course, it's also sometimes very painful sex. So these all add together. I would suggest if you are having any of these, talk to somebody who can actually guide you properly so that if you are having moderate to severe symptoms, we will give you some supplements. Although we have to take care of how we give it, we do some evaluation, we will keep you in check, but we will give you, and that will help you a lot.
Another very common issue many women face is the weight gain. So,
Weight gain, yeah,
I think after perimenopause and menopause, I think, even if you follow what you were always so strict about your diet, but then the sugar cravings kick in, and then there's always a little bit of stress eating, or even otherwise, the weight just doesn't seem to come off for many women. So, what is your take on that? I think, do we accept?
Again, it's a kind of little hormonal driven. As I understand and I'd like to explain is that I told you, once you reach menopause, when the ovaries are not producing your estrogen, is a fat cell that's converting androgen into the estriol or the low grade estrogen. If there is no fat in your body, where is that low grade going to come, which is needed for you, right? So I just put it, I mean, of course, we have to take care that we don't become very obese or we are not exercising. But this is nature's way of giving you a little fat where this hormone will now get converted into the hormone which your body requires. So if that happens, you might breeze into menopause better because those fat cells are working. However, we don't want so much fat cells. I agree to that. But this is nature's way of taking care in that phase. Nature is very smart. They give us things that we need at what time, and we have to really fight against that nature not to be able to. So if you look at back in the days, grannies, they'll become a little plumpy at the time when you found them as granny, right? That must be the time when they were getting into menopause. They'll have the soft skin and little tummy fat. Well, there you go. But of course, you have to make sure that you do not exceed the BMI too much. Diet is, again, we didn't speak about it. But in the lifestyle management, we focused on talking about exercise and what we can do. But diet is very important. Today, we are understanding more and more about the gut biome, how the diet needs to be managed. Because if you are not focusing on the right diet, then you can't outrun it by going to gym. And the biggest challenge for working women is, where is the time to cook? Agreed? Right? It starts from the younger generation, who is the young brigade right now and getting into the corporate world. They are from 9 o'clock to 9 o'clock. No time to cook, amma. That's the answer I get. But that is the long-term thing that can destroy your health. So I don't know where we can fit. Maybe we can have another session of giving tips of how to improve your diet. But I think we need to look into that as well.
We all need it. Yeah,
Yeah.
sure. Also, what about, so just as we said that, there are some red flags in menstruation that you need to go and seek medical help. Similarly, in a menopausal or postmenopausal phase, are there any red flags that need immediate medical care?
Yes. The first thing that I'll tell to everybody is an episode of postmenopausal bleeding. And when do you call this a postmenopause? How do you call that you are into menopause? Whenever your last period, you have crossed 1 year, so 12 months without a cycle, we then clinically call it that you are postmenopause. Okay. Now, once you have crossed that 1 year and say 2 years later you have a bleeding, don't ignore. The first bleeding has to be reported to a gynecologist, where I need to examine where the bleeding is coming from, take a biopsy, and make sure we are not missing. What could be the big problem here? Again, it's on the rise. If you look at the cancers in women, genital cancers, the commonest cancer in women used to be cervical cancer earlier. But with your support and our knowledge, we are doing regular screening. The cancer is coming down. What is growing up is the breast cancer and the cancer of the uterus, which is called the lining, the endometrial cancer. a very good, the first instance in postmenopausal patient is the bleeding. So we find that women ignore it for a few cycles, especially the grandmothers or somebody who is very busy. And then they will come and then we biopsy and we find that there's already cancer that's developed. We could catch it earlier. So postmenopausal bleeding, you should definitely report. The second is any cardiac symptom in terms of palpitation, breathlessness, pain in the left arm, or something that is not feeling right, you must report because, as I said, cardiovascular disease is higher. Unfortunately, for osteoporosis, there is no symptom. The knee pain and the back pain is not a sign of osteoporosis. It's a silent disease. But yes, of course, if you are continuing to have knee pain or some other pain, get yourself evaluated whether you just need a physio or do you need any other support there. And last comes, which we spoke about, is if you are feeling too depressed or not really feeling yourself, I think don't ignore it. We can help you and we will help you. I think that is where you need to reach out.
Very important. And how do you think the family members will come to the workplace a bit later? But I think that is something which every woman wants, a very supportive family who understands all about menopause. So, what would your advice be to the family, the sons, the daughters-in-law, the husbands, above all?
Have patience. Have patience because this is just a phase. There's nothing gone wrong with that woman. But sometimes we do have these families or family members come and say, we just can't handle it. So I think if the point becomes that much, then we will give them, the women will support them with medications. But the family members, as I said, has to have patience and understanding. Really nothing else we can tell them because they have to have, I wouldn't even say sympathy, but empathy for that woman who is going through. And they have to understand it's just a phase. It could be 3 months, 6 months, 1 year. Phase will go. 100%. I can guarantee you that. Nobody remains in menopausal phase for lifelong. But if you support, that phase may be small, shorter, because she knows she has love and affection of you and she will be able to, or she will try her best to get out of it. Because ultimately she has to accept those symptoms and, just get over it. So that's what will work.
Now we will come to, the way businesses and entrepreneurs and startups. So what can they do to generally, show empathy and support women in the workplace, which is a big thing now when so many women are in the workforce, so many women are leading businesses, starting businesses, blazing trails. So I think there, just wanted to know what you think a workplace should do to support women. And there's something called a menopause-friendly work culture. What is that? Is that possible? And also, a lot of our viewers today might be having their own businesses. So what should they do to support the women in their setup?
I think keeping a positive environment in the offices and corporate world comes from top down. I think the leader of that organization should be able to understand what we are talking about. Let me now divide them into two groups. Is the younger women, say in their up to 40, and then there are women who are not having so much of menstrual problem, but perimenopausal menopause, right? So the younger women who are having, say, may have 1 day of severe pain during periods, maybe no disease, maybe some disease, I don't know, but they may require some support there. Today, in most corporate world, there is work from home option. Why can't the HR give them a clear-cut indication that if you have this, you can take work from? And it's your right. You don't have to beg or be on the back foot that I needed this. And that will give the confidence in that young women that, okay, I had 1 day problem. I still work from home, but I'm still productive rather than putting them on back foot. Or if you cannot do that, make sure you have some safe space for them to unwind for a little while. Maybe provide some hot packs for them. Maybe as a room with good music where they can just go for some time, unwind and come back. These are very small things. I think if you invest in that, you'll have much more productive. We can see women are much productive everywhere. Even if you look at the school exams now, the girls are doing better. I know they can do better. They're always better, right? But you have to understand, because even if there's a man, if there's a man, what she's suffering is what you are looking at. Understand what I'm trying to say? If she does not have menstruation, does not bleed, where is she going to give the child you are looking for? It's a give and take. So I think there has to be understanding. Then comes the little women who are in their 40s and may not have so much of menstrual problems, because if it is, it's already solved for them, but they will have perimenopausal, hormonal changes and things like that. And I was just trying to give the tip to women themselves. If you have those little days, if you cannot, get into any trouble, schedule so that you don't have to do that. So you can, in your own way, schedule your things, if you can. Sometimes you may not be able to do that. Then again, instead of judging them that they're perimenopausal, there will be mood swings, I think there has to be a culture in the office to understand these things. And it should be openly spoken about, not hidden in a room or put on the carpet. Because if we do that, women don't come out with their problems. And I have yet to see, I'm a working woman and I have so many women around me who work. I have yet to see somebody make unnecessary demands just because I don't even get to know when what is happening to them. So 90% of them, they grin and carry on. When it goes above their head, they ask for. So I think it has to be a very, very open communication and should be made available.
Absolutely. I have an interesting question here from founders of Laki, which is a brand which is focused on menstrual hygiene. We interact with users across different age groups, they say. So they're asking how startups like theirs can contribute to conversation and solutions around not only the period, but also the perimenopause, menopause.
They can do great things. You can have small group meetings. You can go to, actually, I used to do a lot of these in schools. Don't find so much time now. But I used to go and talk from girls from 6th standard to 10th standard. And I felt that if a doctor could go and talk to them, they'll probably listen better. So you can have conversations at school level, college level, young corporate employees, entrepreneurs, even in the villages and kitty parties. So many women join that. Why not, have one session like this in their kitty parties instead of just having a chit chat? Because believe me, when I go and talk, I realize that so many of them actually did not know that this needs to be done.
Yeah, absolutely.
That's the reason why if I get an opportunity, I close all my work and try and come to this forum or anybody else and say, okay, if I can connect to so many together, I'm most delighted. Because knowledge is power. If I know, I can take better myself. And it's not that, okay, women do ignore their symptoms, but it's not that they don't want to be better, right? And most often, other than when we talk about malignancy, it's about quality of life. I also find women sometimes come to me, say with fibroids or endometriosis, and when they come to me, they've already been suffering for years. When I ask them, literally 2-3 days, they are not out of their home, they are in the bed, but they don't want to come for a surgery. They're dilly-dallying, somebody saying, oh, bear it, it'll go by menopause. I have only one question to them. I said, do you want to reclaim your life? You have 30 days, 3 days, you're off. You're only alive for 27 days. What happened to those 3 days?
True.
Take the right treatment, right? Reclaim your life. And when they come back to me within few weeks of surgery, and the smile itself tells me everything. I understand how they were neglecting. So don't neglect. Please don't neglect.
We have Jinisha Jain asking, how do hormonal changes impact decision-making, focus, leadership in high-pressure work environments?
I don't think it does. What did you say the name was?
Jinisha Jain.
Okay. Jinisha, if you think that menopause is affecting you, it will. But I don't think in 90% situations it does, unless it's giving you a lot of menopausal symptoms as a vasomotor symptoms. For example, say you are in an office or you're conducting a meeting and you get a hot flash. So for a minute, you later have to stop because you just cannot think straight. If you're not having that much, then I don't think just because your hormones are coming down or your estrogen is down will cause any reduced mental faculty. Keep your mental faculty high, believe in yourself, and that will work. But if the symptoms are so much that you are just not able to perform, take treatment, take help, and that will help you. We know that low estrogen or low hormones can cause little short-term memory problem. can cause, you will say, oh, I forget. Could also, the men also forget. It's not that only we are forgetting. Why are we so hard on ourselves, right? I think a 50-year-old man will also forget half the things if I tell him. But they won't even listen to what you're saying and they'll say, I forgot. So let's not be hard on ourselves by saying we are menopausal, so we are having all this problem. I think the truth lies in how we go about it, how we look at it. And of course, if there is a pathological problem, there is a symptomatological problem, we have to look into as medicine. But I think all of you are genuinely very good, are aware of how you should take care of yourself. So I think you should follow that.
So I think that has been a very, very interactive and illuminative discussion. As always, Dr. Rooma, we've done a lot of sessions together.
Thanks.
So this is enjoyable as always. So viewers, I do hope you enjoyed our session. So hormonal health, as I said, is not just for women. I think it's part of the sustainability of your career, of your business. So let's foster team support, how we break old taboos, write a new script where women at her hormonal peak is not seen as less, but as somebody who is evolving to an even deeper strength. As doctor said, I think positivity is the key, acceptance is the key, and we should remember that we have to put our health and our cycle on the calendar and take care of it every single day. And also a request, share what you have learned today with another woman in your household, in your office, who could not be part of this session. And know this, that your menopause is not the end. It's actually a power shift. So stay strong, stay supported, and keep building with grace and elegance. Thank you so much. Thank you, Dr. Rooma. Thank you, everyone.
Thank you very much.
And see you soon.
Thanks so much for joining us. Have a wonderful day.